Welcome to the Swain Sinus Show, a physician and patient discussion on how to better manage and treat mild to serious sinus issues and conditions. From diagnosis, treatment, home remedies, and surgery, Stacy and Dr. Swain will talk about improving your quality of life, breathing easier, and feeling better. Let's take control over our sinuses and allergies so they don't control us.
Hello, Dr. Swain.
Hey, Stacy, how are you?
I'm great. We are now several episodes into this podcast, and we've been receiving some questions.
Great.
So I thought I might throw out some of the questions we've been getting that are really more maybe myths, and I'd like for you to tell me the true fact.
I'll do my best. Here we go.
All right, so I'm going to shoot these at you. All nasal sprays are addictive.
False. Some are not. Typically, the nasal steroid sprays that people, are sold over the counter, Flonase, Nasonex, Ronacort, those are not addictive. The decongestant nasal sprays, things like oxymetazoline or neosynephrine, they can be addictive. Usually, if you read the package insert, it'll tell you on the packages, do not use more than 3 days. So those medicines, they make the blood vessels constrict, and so people can breathe better through their nose. And usually, that's good to use if you're acutely ill, and you can actually follow that with a nasal steroid spray. But the nasal steroid sprays themselves are not addictive. The nasal decongestant medication can be.
Great. So if my snot is green or yellow, it means I have an infection.
Maybe. Big maybe. If you have, discolored drainage from your nose and you've got fever and facial pain, or, people talk about their teeth hurting and they're congested, then it's probably reasonable to assume you got a sinus infection. If you blow your nose and you've got some yellow drainage, doesn't necessarily mean that you have a sinus infection. All
right, I'm going to take a little tangent on that. Why do my teeth hurt?
Why, when you're acutely sick?
Yeah.
Your maxillary sinus sits right above your teeth, and when the sinus is closed, you can get negative pressure in the sinus. And so if you've got a closed space that's full of pus, that hurts.
Never thought about that. All right. I've also heard, and people have asked about, local honey will help with my allergies.
Maybe. The thinking behind that is the bees, they're using local pollen. If you take a little bit of honey, that is giving you some exposure to that local pollen, and that can help you not react in such a strong way to allergens such as pollen when you're exposed to it.
I do like to use local honey.
A lot of people do, and some people swear by it, but the studies are not 100% in agreement that is something that's going to be completely accepted.
Fair enough. So the next one is sinus infections aren't contagious.
False. They can be. Not everyone is walking around when you initially get sick with some bacteria in your sinus. Usually it starts with a viral illness, and the viral illnesses can be contagious. So if you're around someone who's sick, who has a sinus infection, yeah, you might end up getting sick.
I always hear, once I'm on antibiotics, I'm not contagious.
That's a great question. When someone comes down with an upper respiratory tract infection, they talk about between 24 and 72 hours where they have viral shedding, where they're sneezing and they're coughing, and all those viral particles can be aerosolized and you can pick up an infection. Once you've passed that acute phase and you're on some antibiotics because they have a bacterial sinus infection at that point, usually people are not as contagious. But if someone's sneezing a lot, I don't know that I would want to get around them
anyway.
Either. Yeah.
Right. Stay clear. Some folks, this might be a little controversial, would say that if I'm a smoker, it doesn't affect my sinuses.
Right. Big fat false on that one. Smoking is one of those things that there are no good things that come from cigarette smoke. I have a lot of patients that would argue against that still think that it's okay, but I think the science is pretty definitive that smoking is not good for any part of your body.
So I'm going to go a little lighter topic next. Do sinus issues cause bags under my eyes?
Well, most of the time not. However, there are things called allergic shiners. And if you look online and see what the term allergic shiners, there'll be people that have kind of look like discolorations underneath their eyes, not necessarily a swelling. People with bad allergy symptoms can have facial features consistent with swelling or discoloration of their eyes. It kind of depends on the situation and the person that you're looking at. Everybody's a little bit different, but that is a term. Allergic shiner is a term.
I've never heard that before. I'm going to have to look it up now. I learned something new today. I learned something new every day with you. My last question, and this one's come from some folks who've listened to our podcast, is if I have a sinus issue and I come to see an ENT doctor, I'm going to have surgery.
Right. The answer to that one is false. When you have a sinus infection, there are lots of different ways to go about treating it. If you look at the vast number of people that have sinus infections in the United States each year, only a small percentage of those people actually end up in the operating room. So the majority of people can be treated and can be treated effectively without necessarily having to go have an operation.
Well, that's great news.
It is.
Well, I thank you for answering some of our listeners' questions and some of the crazy myths that I've heard out there. And those of you listening to us today, let us know if you have a question, and in a future episode, we will answer some of the myths and questions from you. Again, remind everybody how to get in touch with you if they want to come see Dr. Ron Swain.
So you can call us. The number is 251-470-8823. Again, that is 251-470-8823. Or you can find us on the web at drronswain.com.
Great. Thanks, Dr. Swain.
Thank you.
Thanks for listening to the Swain Sinus Show. Please subscribe to our show on iTunes, Overcast, and anywhere you download your favorite podcasts. Want to know more about Dr. Swain or to schedule a consultation or appointment? Visit SwainSinusShow.com or call his amazing nursing staff at 251-470-8823. We would love to hear what you think about the show. Email us at drswain@drronswain.com. Again, thanks for listening. Breathe easy and have a great day. This show is brought to you in part by the fine physicians and friendly staff at Premier Medical Group in Mobile, Alabama.